A certain percentage of the population is afflicted with emotional or mental disorders, for which therapy is required. Such individuals should schedule an appointment with a Denver psychotherapy professional if such a disorder has begun to manifest. Such professionals are qualified to make an educated diagnosis and help the individual to improve his or her quality of life through different types of therapies and treatments. Numerous therapies of this kind focus on counseling. Throughout these sessions, the psychotherapist questions the client in an attempt to get to the root of the person's issues. Each appointment usually lasts about 60 minutes, although the time for each session will vary significantly from one client to another. The primary goal of the aforementioned therapy is to help patients to run their lives in an efficient manner despite their disorder, whether emotional or mental. In numerous cases, a person can be cured completely and go on to experience a normal, symptom-free life. In other instances, the patient is merely taught to control and manage the symptoms of the condition and subsequently keep them under control. Certain psychotherapists use non-traditional ways of communicating with their clients. This is particularly popular among those treating individuals who cannot efficiently express their feelings through oral communication alone. Most practitioners use two different types of therapy, which are psychodynamics and behavioral therapy, the latter of which is also known as cognitive behavior treatment. Understanding each client's problem is the objective of most qualified professionals. When this goal is met, treatments can be adjusted for the purpose of eliminating subconscious resistance on the part of the patient. Most individuals are completely unaware that this is occurring. However, if such resistance is not broken down, therapies may prove ineffective. Psychotherapy also centers on changing the client's pattern of thinking and therefore his or her behavioral patterns. Most psychotherapists put time and effort into explaining the link between thought patterns and behavior. One of the goals of such treatment is to help clients identify the thoughts that lead to destructive or negative actions and interrupt these patterns. Once they are broken, the patient's prognosis is much better. Various patients require the aforementioned psychotherapy. Clients may be suffering from bipolar disorder, depression, schizophrenia, anxiety, obsessive compulsive disorder, post-traumatic stress syndrome, panic attacks, or phobias. However, it is important for patients to realize the changes are unlikely to take place overnight. Instead, at least 20 sessions are generally recommended prior to one making progress with regard to the control or limitation of symptoms. In numerous instances, the treatments recommended by Denver psychotherapy practitioners involve exercises that the client is expected to complete in between visits. These may include relaxation techniques, such as visualization or breathing exercises. Therapy is generally considered successful when the individual's disorder or illness ceases to interfere with his or her activities of daily living. Those who think they may have an emotional or mental condition should seek the help of a professional at once.